Hi there, my name is David Coletto and I'm the CEO of Abacus Data. Welcome to In Focus. On February 3rd, I led a panel discussion with leading experts and policy leaders exploring how self-care is being used around the world and how it can be used in Canada to improve not only patients' health outcomes, but also improve the sustainability of Canada's healthcare system overall. Here's what we heard. At the end of 2020, our firm did a national survey of 2,000 Canadian adults, exploring both their perceptions of the health system, how COVID has impacted their views, and also then asking questions about their views around self-care as a policy tool to help sustain the system. Just to give you a sense of where sort of the full policy landscape is, when we ask Canadians to rate their top 3 issues, and we give them this list of them right now from a public policy perspective, and we ask them, beyond the pandemic, because that, as we've seen in our research, is the focus for almost everybody at this moment. What we do see is that healthcare as an issue at the national level does rise up to the top, with 65% of Canadians saying that it is either the first, second, or third most important issue for them. And healthcare has been in the top issue set for as long as I've done polling over the last decade, but it's ebbed and flowed in terms of its general importance. And I think what this pandemic has done, as Jerry alluded to, as others have alluded to, is it's put a focus, a spotlight on our health system for the good and the bad, right? We do feel that the system's responded relatively well to this pandemic, but it's also raised some doubts and some questions about the long-term capacity of the system. How do Canadians, consumers, patients access care? And how are we going to evolve over time? And so compared to some other issue sets, I think Canadians are really focused on healthcare. We also wanted to understand, do Canadians understand both the threats and the opportunities within the system? So for example, we asked people whether these 3 items were things that could improve healthcare over time, or would they be threats to weaken it? And you can see the vast majority of Canadians feel and believe that scientific innovation in diagnosis and treatment, digital technology that makes sharing information easier, and the use of virtual care for patients to access and interact with health professionals are all things that most Canadians feel will make the system stronger. And I think the pandemic has certainly accelerated many of the trends in this space as we as individuals have sought information about how to protect ourselves from the virus. We've more than ever had to interact with health professionals through venues like this. And so I think this has moved the public's understanding and appreciation for these. On the flip side, there's 3 items that really pointed to threats that Canadians are feeling. Certainly the pandemic has itself been seen as a threat to weaken the system, right? Exhausted healthcare workers, challenging capacity issues, have put a spotlight on the fragility of our health system, despite how important and critical Canadians view their publicly funded system. But we also see broad understanding that our aging population, Canada, like many Western countries, is actually aging over time. One of the stats I always like to use is that in the next 20 years, the number of Canadians aged 85 and older will triple from about 700,000 today to 2.1 million 20 years from now. And given the volume of spending that governments have had to do to protect Canadians through this period, there's also concern that government debt and deficits are going to be a further source of threat. So much so that when we ask people to anticipate, do you think governments are going to have to spend more or less on healthcare spending over the next 10 years? 3 out of 4 Canadians say that healthcare spending will have to increase. So our polling suggests that the issue landscape, people recognize there's a problem, there's a challenge, and that sets the platform around self-care for us to talk about. So to the panel, and I'll start with Nardine again, and it's not always going to happen that way, but I'll start with you. How do you think, from your interactions with health professionals, with the data that you've seen, how has the pandemic changed the public's perception about healthcare and the healthcare system more generally?
Yeah, so I will say I believe in the results of a May 2020 survey commissioned by the FHCP supports the fact that the pandemic has really increased the interest of Canadians in their own health and motivated them to practice a range of self-care activities and to seek out more information to help them practice better self-care. So we found that in fact half of all Canadians surveyed said that they're now more comfortable practicing self-care since the pandemic began, and 40% said they've actually looked for more info on how to protect themselves during this time. And so I think by paying closer attention to their health and their symptoms of illness, by enhancing their self-care behaviors like more regular hand washing, so minimizing the risk of the viral transmission, I think the public has really gained a greater appreciation for the value of self-care and its value as a first line defense in public health emergencies. So that's what I think about the public's perceptions about healthcare in general. I would agree with all the results you presented, David, regarding their perceptions of the system. I think many Canadians are dissatisfied with the emergency room wait times and access to family doctors and just kind of an inconsistency of healthcare across the country and the capacity of the system. But on a more positive note, I would say I think people have also expressed way more appreciation and gratitude for health professionals and long-term care workers, PSWs, and other people who are working tirelessly throughout the pandemic. So that's a positive. And I think as the pandemic and government imposed restrictions continue, I think patients will have turned to pharmacists more often because we are readily accessible, the most accessible healthcare practitioners for support and expertise. So moving forward, I hope that patients will continue to seek out pharmacist-led care and have them, have us assist and facilitate their self-care decisions, as this pandemic has really helped solidify our role as these reliable and competent and obviously accessible healthcare practitioners.
And to Christine and Judy, are you seeing the same kind of trends or data coming out of other countries where the same phenomenon's happening, where there's this focus on the system and maybe doubts about its ability to cope with not just a crisis, but an ongoing basis? Maybe Christine, I'll start with you. Sorry.
Yeah. Yes, I do see that in Europe we have some of the same discussions, and that many of our welfare systems have some cracks that are you only really see when you are in big trouble.
I'll go to Judy on the same question. From your vantage point, how has the pandemic, has it accelerated the conversation about self-care from your interactions with different governments and the World Health Organization?
Yeah, David, I think, well, the world has changed forever since the advent of COVID, and health systems will never be the same again. So we saw, as people have said, lots of cracks in systems around the world. But we also saw some changes, regulatory flexibilities, for example, that took place that were good things. And we hope that they will stay in place. And we're certainly working towards trying to forge that mechanism. But especially, I guess, in the developed world, some people will never have to go and visit their GP again. If they need to talk about the management of their osteoarthritic knees, you can do it via telehealth. So I think there's been shown up lots of cracks, but also some things that we can really make use of, like digital health data, the good use of health data, digital health literacy, for example. But I just wanted to touch on what Nadine said about also it's really shown that now is the time for self-care. Self-care has come into its own, and now is the time to really use the pharmacist, that trusted voice, that trusted health professional that has been underutilized and undervalued, I think, for so many years. And so I think there are two things that have been an opportunity, if you like, from the self-care world point of view, even in all this tragedy.
And Jerry, one of our audience members asked about, and I think it ties back to what just Judy said there, the role of a health professional in guiding consumers to making better choices. Is there other things? Like, is there a role for technology in that? Augmented reality, digital technology that can, and I think it's part of the health literacy conversation about empowering consumers to then know what the right product is for them if they have, a cold and they don't need to go see a physician.
Oh, absolutely. And I think it's yes to both questions, David. I think Canadians have long wondered why information technology hasn't impacted their experience of healthcare the same ways as it's impacted just about every other aspect of their lives. We don't get paid the same way. We don't invest the same way. We don't seek out entertainment. All of these things now involve, just massive changes thanks to information technology. Yet the experience of healthcare, at least from the patient perspective, has not really been impacted the same way. And let's take a look at that whole area of information and guidance from health professionals. Right now, safe and effective use of our members' products, over-the-counter drugs and natural health products, is really all about informed use. And essentially, for the last 100+ years, the only two tools we've relied on to ensure that has been the printed labels on the cartons and bottles, and the advice of a pharmacist, coming from a bricks and mortar pharmacy. And in both cases, we are missing such opportunities to leverage information technology, and whether that's ensuring that people can obtain the products as well as information, remotely, and of course in the pandemic, that's a bit of an issue. But it's really just about accommodating all the different information styles that exist out there and being able to support Canadians, whatever their preference is. So it's not about changing who we rely on. Pharmacists are always going to be critical, but it's how do we access pharmacy? Just one example.
Well, thanks for that. So I mean, the theme coming out of this is there's now a demand both for action on healthcare. There's a realization that we've got a challenge, but also COVID itself has accelerated, many of our behaviors that we thought might take 5-10 years to get to. Well, I always say I now have my boomer mother who spends almost all her time on YouTube. That is just, and we're, Zooming for Easter dinner as opposed to, getting together. These are all things that I don't think we would ever imagine we would be doing. Well, that concludes the latest episode of In Focus with David Coletto. On behalf of my team at Abacus Data, I want to thank the panel and for all of you for tuning in today. For more episodes on this subject or others like it, please subscribe to our YouTube channel, and I hope to see you next time. Take care.